Hello and welcome to the course talk for the PgC Practice Education for Health Professionals. My name's Zoe Grant and I am the course leader. So why choose to study this course? The University of Suffolk has a unique postgraduate offering for health professionals that is growing year on year, and practice education is one of the key areas of focus within this delivery. Whilst the postgraduate certificate does help you to understand various learning and teaching models, we really pride ourselves on grounding these theories within the UK healthcare clinical environment so that you can visualise how you can take the certificate into practice. It's about enabling you to feel empowered in the learning environment and supporting all of your learners, whoever they are. One key principle that has been woven into the design of this course is a collaborative approach. This embodies the multidisciplinary approaches we take within our clinical professions and actually means that we have opportunities to learn from each other. Now you know a bit more about the course and the aim of the course. Why study at Suffolk? University of Suffolk is a small university and we have a big heart which focuses on ensuring that all of its learners feel included. And you, as the learner at our university, will have access to strong support mechanisms, including the Student Hub, library, and learning and academic support teams. Practice education is important, vitally important, in ensuring that we have competent, confident professionals in the future. As registered healthcare professionals ourselves, we know that the importance of good quality practice education supports learners is a growing need, and the workforce is developing, and we need to ensure that our practice educators are well educated themselves. As a practice educator or somebody in an education role within the NHS or private practice, you will be familiar with supporting a range of learners. We are aware that the term learners can encompass a variety of undergrad or pre-registration students, postgrad students, internationally recruited staff, or training staff in your particular area of practice, and that the sphere of practice education continues to grow. Completing this course will equip you to apply learning and teaching theories, to understand how to assess for learning and develop feedback delivery. You'll also be enabled to deliver teaching that values inclusivity of all your learners, but also empowering you to make a change in the education delivery in your department or area of practice. There are 2 modules on this course, and both have been aligned to the NHS Educator Workforce Strategy and complementing the NHS Long-Term Workforce Plan. We've considered enhanced and advanced practice frameworks to ensure that learning gained alongside this course can help you with your long-term career aspirations. For the first module, you'll look at the foundations of learning, teaching and assessment. We'll look at theories of learning that are applicable to the clinical settings and teaching models that have been adapted in recent times, but also thinking about new models. Principles of assessment for and of learning, and actually that can just be simply checking what your learners have learned or your students have learned within that tutorial you've delivered. Assessment design, and also we'll look at AI and other technologies in adopting these for assessment. Reflexivity as a teacher is as important as it is as a clinical practitioner. So we'll look at ways that we can reflect on our approaches to teaching, including with your 2,000-word reflective assignment, and thinking about how you may adopt some learning theory and models of teaching in the future. Inclusivity in teaching and assessment design runs throughout the module, and you'll apply these within your 20-minute presentation, where you'll design a learning activity and appropriate assessment of knowledge of your learners, and drawing on appropriate theory and adopting any innovative approaches that you can apply to your learning activity. I will now pass over to Charlotte, and she will talk to you about the second module.